Hi, my name is Alana Cradle. I'm a Seton Hall MSN, entry-level MSN CNL student, and I've been assigned to the VA, Unit 9A, Oncology, Hemonc Oncology, and I've been looking at decreasing the number of inpatient falls here on the unit. A big factor is patient safety and team collaboration on the unit. So I've created a mock fall scenario. Today is Wednesday, July 3rd, and the mock fall scenario entails looking at environmental factors that can interplay or be a part of triggers or causes that would lead to a patient being in an unsafe environment. And I've included all of the RNs on the unit, the LPNs, the CNAs, the unit secretary, and environmental services. I've already done the mock fall scenario with the night shift, the day shift, and I'll be working with the evening shift later today. As I draw the curtain, you will see that the mock fall scenario includes looking at different factors such as an IV line that may be too long, a call bell that is not at the bedside or within reach. In this case, the call bell, you will see, is actually over by the oxygen. You'll also note that the bed is too high and all of the side rails are down. There's a mat on the floor, but the scenario that I created was that there was a 65-year-old female white patient who was admitted to the unit 2 weeks ago, and she came in from a nursing home, an outside facility. She came in for dementia, and she was tested here for a UTI, and it was positive. But in addition to that, she's status post cycle 2 of her chemo treatment. The patient did not call for help, but obviously the call bell was not within reach. So she climbed out of bed, used the restroom, and in coming back tripped, and we have now found her laying on the floor. And I brought the staff in because I wanted them to identify, well, what within the environment could have been a part of identifiers that could have prevented this patient from falling, and how could we have worked as a team, right, to create a safe environment. Some of the factors were making sure that this chair was out of the way. As you can see, it's blocking, right, to and from the passageway, the corridor, to the restroom. We already mentioned that the bed was high, the side rails were down, but also it's policy here on the unit to put falling stars at the headboard as well as at the outside of the door so that staff can identify that in fact this patient is at risk for falls based on the score from the Morse fall scale, which is what is used here on the unit and actually throughout the VA. The other identifier would have been a green wristband, and as we can see, there is no wristband on this patient. The other thing that you can see is that the telephone line is very long and also could have been a factor in why this patient fell. Also, these mats, which are used to prevent falls or to cushion the fall if the patient were to roll out of bed, once the patient is in bed, we place the mat on the floor, but if the patient is out of bed, we are to remove the mat and put it aside to prevent that patient from tripping on the mat, getting into the bed, getting back into bed. So in working with the staff, all of these matters. Oh, and lastly, no skid socks were on this patient. And it's not just a matter of placing skid socks on the patient, but making sure that they're actually placed on the patient properly with the skid part to the bottom of the foot rather than to the side or to the top of the foot. In meeting with the staff, all of these identifiers and factors were actually pointed out by them. But then the question came into play of, well, how can we work as a team? How can we collaborate as colleagues and make it so that I'm not just responsible for my patient, but at the end of the day, this is the unit's patient. Thank you. And now I'll continue with my presentation.